Hi, I'm here with Kelly. She just gave an awesome presentation about fatigue and people on TKIs, and so I just wanted to interview her about that. Could you give us a little summary, please?
Yeah, so my name is Kelly Hyland. I'm a graduate student at Moffitt Cancer Center in Tampa, Florida. And we did a study looking at patients with chronic myeloid leukemia who are taking TKIs for the treatment of their disease. And so this was a cognitive behaviorally based intervention where we intervened on things like sleep and activity, and then also kind of thoughts around both the medication and the fatigue, because we know that sometimes those thoughts can get in the way and be really unhelpful.
For sure.
So some tips for patients taking TKIs, especially if you're experiencing fatigue. First of all, we know that that experience is really real and really can be really disheartening. And some things that we've found to be helpful are first looking at your sleep. So we think about, it's called sleep restriction. So can you try to go to bed as close to the same time and wake up as close to the same time each day as possible, independent of how you feel. So even if you're really, really tired, trying to get up and go to bed at those same times. And also eliminating napping to the degree possible. And we find that this really sets the foundation for you to be able to do more. Also thinking about activity, so trying to be active and do activity in a meaningful way. It doesn't have to be going to run a marathon. It could be just going out and walking even for 5 minutes a couple times a day, and slowly building up what you're able to do. So maybe the first day you walk 5 minutes, and then the second day you walk 6 minutes. Some other thoughts about kind of the thoughts that can come into your head, when you feel like that fatigue is just so overwhelming and there's nothing that you can do about it. It can be helpful to remind yourself that it's temporary, right? So to remind yourself of moments when you haven't felt fatigue, and this idea that, it will pass, it's not forever. And also, that idea that there are things that you can do. So a couple things that I even just mentioned here, like sleep and activity, even though you have to take this medication and it's so important, there are things that are within your control that can help.
That's wonderful. And could you tell us how you feel about people with lung cancer?
Yes, lung cancer is my passion project. So I worked with lung cancer patients on an intervention to help lung cancer patients who continued to smoke after diagnosis in my past life as a research coordinator, which was a really awesome intervention. And then for my thesis study, I studied loneliness in lung cancer patients, which was really interesting. And now I am looking at positive psychological constructs in patients with lung cancer. So looking at how things like hope and pursuing your goals and things that are important to you are related to outcomes like better well-being and creating meaning and purpose. So I love lung cancer patients.
That's awesome. Thank you so much,
Thank
Kelly.
you.